Ballal, let me come to you because Karnataka and Bengaluru in particular now becoming a major worry point. Are you worried? Have you been taken by surprise by the sheer numbers that Bengaluru has faced in the last 10 days and the deaths as a result due to non-availability of ICU beds? Has that in a way caught Bengaluru, which prided itself on a strong health infrastructure, completely by surprise?
Good evening, Rajdeep. Good to be here on the show. It's a tragedy of sorts listening to you and also seeing the visuals of the number of people dead in our beloved city of Bengaluru and the state of Karnataka. It certainly has taken us by surprise. The sheer volumes, the ferocity and the speed of transmission of this disease in the second wave of corona is unprecedented, unexpected, and certainly was unplanned for. So we need to break this chain of transmission as soon as we can, so that we can stop the number of deaths and also people, bodies being crowded in the crematoriums. And the only way of doing this is, first and foremost, right now our main task is to reduce the number of deaths of patients coming into the hospital, which means we have to triage them, take care of the really ill in the hospital beds, in the ICUs, and the rest of them at home. So I think also the lockdown which started today, in my opinion, will start bringing down the number of cases, because the chain of transmission will certainly be broken if people stay indoors and only step out either to save a life or to earn a living. So I do hope in the next 1 or 2 weeks, we'll start seeing some lowering of the numbers and hopefully the lowering of deaths. This is an unheard of situation in the Garden City and the IT city of Bangalore, and it's truly tragic, Rajdeep.
Right. You know, when I look at the numbers between April 1 and May 9th, which is the second wave, Bengaluru's COVID count, Dr. Ballal, touched 5.3 lakh cases. 1.8 lakh people have recovered, so recovery rate is increasing. But there is a large number of active cases and you're continuously adding more infections. Over 3,000 deaths reported. Now, I asked you about ICU beds. Is it simply that the demand has outstripped the supply? That despite your best efforts, you just don't have the beds needed?
Absolutely. I think the demand has certainly outstripped the supply. Our doctors and staff are working 24/7 without any rest. And, taking care of a very sick, ventilated patient is very, very stressful, physically burned out, and mentally people tend to burn out. I think there are just not enough ICU beds. Hopefully, with the numbers coming down and the new arrangements made by the Honorable CM and the government of increasing the oxygenated beds and the ICU beds in the private medical colleges would give us some succor. But as of now, it's really, really hard to get an ICU bed in any private hospital or government hospital in Bangalore.